The Supreme Court set up a national task force on Saturday to streamline the oxygen allocation to states across the country, a move that came in the midst of a second wave of the coronavirus pandemic that has stressed the healthcare sector and sent the demand for medical oxygen among COVID 19 patients soaring. Several states have complained of a crippling shortage of medical oxygen, with reports of deaths due to its non availability coming in from several parts. The 12-member task force formed by the Apex Court will also review and suggest measures to ensure availability of essential drugs and medicines and help the states in adopting remedial measures to ensure preparedness for future emergencies. It will facilitate and provide response to the public on COVID 19 queries based on scientific and specialized domain knowledge. It will be at liberty to formulate its own modalities and procedure for functioning. A person suspected of having coronavirus disease need not produce a positive test report for admission to a COVID 19 facility, according to a government directive that also says patients cannot be refused services on any count. The Union Health Ministry revised the policy for admission of COVID 19 patients to various categories of facilities for them on Saturday, even as the second wave of the deadly infection raged. This patient centric measure aims to ensure prompt, effective, and comprehensive treatment of patients suffering from COVID 19, the policy document said. The new guidelines will be applicable in all the hospitals under the center, state government, union territory administration, as well as private hospitals managing such patients. While 1,70,841 COVID patients across the country are on ventilator, as many as more than 9,02,000 patients are on oxygen support, the Union Health Minister Harshvardhan said on Saturday. In his virtual address at the 25th meeting of the group of ministers to discuss the pandemic situation, the minister said that 1.34% of COVID caseload was in ICU, 0.39% of cases were on ventilators, and 3.70% COVID patients were on oxygen support. The Supreme Court has set up a national task force that will ensure streamlining of oxygen distribution as COVID-19 crisis in the country has caused massive shortage of oxygens in hospital. Delhi, Uttar Pradesh, West Bengal, Karnataka are some of the states that have been ravaged by oxygen shortage. Prime Minister Narendra Modi, meanwhile, on Saturday spoke to chief ministers of Maharashtra, Madhya Pradesh, Himachal Pradesh and Tamil Nadu on COVID-19 situation in their states. A drug to treat COVID-19 patients developed by the DRDO has been approved for emergency use by the country's top drug controller as India battles the second wave of the pandemic. The drug comes in powder form in a sachet and is taken orally by dissolving it in water. A DRDO lab and Hyderabad-based Dr. Reddy's Laboratories developed the anti-COVID therapeutic application of the drug to deoxy-D-glucose, which is 2-DG. The Drug Controller General of India cleared the drug after clinical trial results showed that molecule present in the drug helps in faster recovery of hospitalized patients and reduce supplemental oxygen dependence. A higher proportion of patients treated with the drug tested negative for COVID-19 in RT-PCR test. The Shiv Sena today said that while smaller countries in the neighborhood are offering help to India to tackle COVID-19, the Modi government is not even ready to stop the work of the multi-crore Central Vista project in Delhi. The party also said that the system created in the past 70 years by previous prime ministers including Pandit Jawaharlal Nehru, Indira Gandhi and Manmohan Singh has helped the country live through the tough times that it is facing today. The UNICEF has expressed fear that there is a threat to the world from India due to the pace at which coronavirus is spreading in the country. It has also made an appeal that maximum number of countries should help India in its fight against COVID-19. Bangladesh has sent 10,000 remdesivir vials, while Bhutan has sent medical oxygen. Nepal, Myanmar and Sri Lanka have also offered to help Atmanirbhar India, the Sena said in an editorial in its mouthpiece Samna. Hello everyone. HW News English is 2 years old now. When we started this venture, we promised ourselves one thing, that news should remain free, because right to know is the right of every Indian. But to keep news free for everyone, we need support from some of you. And thus we have rolled out membership on our YouTube channel HW News English. But mind you, the membership is completely voluntary. The programs that we were doing earlier, that we are doing now, will continue to remain free. First level is a basic level. Here, you can be our supporter by paying Rs 199 per month. This membership gives you certain perks and benefits. The perks include unique badges in front of your name, a live show from Mr. Sujit Nair and from Mr. Akhilesh Bhargava per month for our members. You can also vote in some exclusive members-only polls. Now the second level is Super Supporter. Here you can be our Super Supporter by paying Rs 3,999 per month. This membership will include every perk that comes with basic level. Additionally, our Super Supporters can be a part of a WhatsApp group where we can have discussions and suggestions on various topics. The second perk includes a gift pack with our merchandise. And the third perk is a Google Meet with Mr. Sujit Nair, where you can join the meet and ask your questions to Mr. Nair face to face. Lastly, if you like, we would give a shout out to our super supporters in our programs. So, hope to see you soon with our badges.